How important is anatomy for NEET MDS 2026? According to the updated NBE pattern, NEET MDS 2026 will have 240 MCQs to be solved in 3 hours, with plus 4 marks for correct answers and minus 1 for incorrect ones. Anatomy falls under part A, that is basic science section. It means if you master anatomy, you are already secured a solid chunk of your score before even touching the clinical subjects. But here is the real twist. NBE has shifted focus toward conceptual and clinically oriented questions. That means rote learning isn't enough now. You will be asked questions like, if your lingual nerve is damaged during extraction of third molar, which sensation will be lost? See the difference? It's not about naming structures anymore. It's about applying their knowledge. So how do you prepare? Let's build a strategy. Step 1. Master head and neck anatomy. Why? Because dentistry is head and neck focused and around 60 to 65% of anatomy questions revolves around this area. Cranial nerve, blood supply of face, and oral cavity, TMJ, muscle of mastication, and clinical correlations like nerve injuries, there are non-negotiables. Make flowchart of cranial nerves, they are lifesaver in the last minute revision. Step 2. Don't skip neuroanatomy. You might think it's too detailed, I don't really need it. Yes, but selectively. Focus on brainstem, cerebellum, internal capsule, visual and auditory pathways. Why? Because NBE loves to ask functional correlation questions. Like, if the lesion in the left internal capsule, what kind of paralysis will you see? Step 3. Gross anatomy beyond head and neck. Yes, the rest of the body matters, but prioritize. Thorax, abdomen, pelvis, only the clinically relevant part. For example, heart anatomy is favorite because systemic diseases reflect in oral health. Same with the liver and pancreas, connection to metabolic conditions. Step 4. Histology and embryology. Here is where most students slip. They think histology is diagram. Wrong. In NEET MDS 2026, you will get image-based questions. They will show you a tissue and slide and ask which organ is this. So revise basic slides of oral mucosa, salivary gland, dentine, enamel. For embryology, stick to development of face, palate, pharyngeal arches and teeth. Step 5. Use smart resources. Don't drown in big books like Gray's Anatomy right now. Stick to BD Chaurasia for basics, Inderbir Singh for embryology, and good review book like Arvind Arora or Dental Pulse for NEET specific. Most importantly, solve previous year NEET MDS question papers. You will start to notice patterns like cranial nerve questions keep repeating in different flavors. Step 6. Active recall and MCQ practice. The latest NBE guidelines emphasize speed and accuracy. 3 hours for 240 questions. That means less than 1 minute per questions. So your brain must be trained to recall instantly. Flashcard, Anki, sticky notes in your mirror, whatever works for you, but make sure you test yourself daily. Step 7. Integrate anatomy in clinical subjects. This is the golden rule. NBE isn't asking you anatomy in isolation anymore. Expect cross-linking. For example, a question may describe a patient with trigeminal neuralgia and then ask you the nerve's anatomical course, or a case of maxillary sinusitis leading to dental pain. See, anatomy meets pathology, meets oral surgery, and different subjects. That's why when you revise anatomy, always think how this matters in dentistry. Finally, let's talk about the revision. Anatomy is volatile. You forget easily. That's why instead of long study session, do short, frequent revisions. A 30-minute daily anatomy slot is better than a 6-hour marathon once a week. By the last month before NEET MDS 2026, you should be revising anatomy every single day in micro sessions. So if I had to give you a roadmap, first 3 months, build foundation with head and neck anatomy and neuroanatomy. Next 2 months, add gross anatomy, histology and embryology. Last 2 months, 100% MCQ practice and rapid revision. Daily anatomy touch-up with clinical integrations. Remember, anatomy is not about memory anymore, it's about application. And once you approach it like a detective solving a case, every nerve, every muscle, every artery suddenly makes sense. If this video helped you clear the strategy, don't forget to like this video. See you in the next video.